Hello,
Hello.
I'm Nicole. I'm going to be the nurse taking care of you today.
Okay.
We're just going to do a quick head-to-toe assessment and make sure everything's appropriate. Can you tell me your name
Carolina,
and what's your birthday?
April 3rd, 1996.
And do you know where you are right now?
Yes, I'm at my apartment.
Do you know what the date is today?
It is December 6th?
I think it's the 10th, but I'm not really sure either.
I'm not sure.
It sounds right. We're in the month of December.
Yes.
Do you know who's president?
Yes, Donald Trump.
Okay. How have you been eating recently?
Good.
You have your 3 meals a day?
Yes.
No problems?
No issues
Okay.
at all.
Well, you appear very healthy. Your
Thank
skin is
you.
well hydrated.
Thank you.
I'm just going to take a quick look at your hair and your face.
Okay.
Your hair is nice and healthy. So we've assessed her level of consciousness and her nutrition. She's developmentally appropriate for her age. Her speech is clear, no problems stumbling over words. There's no slurring. Can you smile for me? Perfect. Can you wiggle your eyebrows for me? Okay, perfect. All right, and your hygiene is wonderful. Your hair is clean. Your skin is clean. I'm just going to take a look at your eyes. And we're going to be checking for the red reflex, and then looking at her nerves inside her eyes. All right, here. Very good. Okay, if you'll follow my finger.
Okay.
Very good. Any visual problems recently? Been going to your yearly exams?
Yeah.
No
I wear
difficulties?
contacts.
You wear contacts. Me too. Okay, I'm going to take a quick look at your ears.
Okay.
I'm just going to change this out. All right, any pain with this? Okay. There's no redness or tenderness to the ear. Just going to look inside. Looks good. You look on this side. No pain? No? Okay. Any hearing problems recently?
No.
Okay. The insides look good. Not too much wax in there. And your eardrums look good. Okay, we're going to check your hearing. And you're just going to tell me when you stop feeling it, okay?
Okay. Okay.
Okay. And we're going to do behind your ear as well.
Okay. Okay.
Okay.
Okay.
Very good. Okay. Let me see your arms. The temperature is good. They're warm. They're dry. I'm going to check your fingers. Your fingernails look clean and healthy. Cap refill is good. And check your pulses. You're strong and even bilaterally. No signs of clubbing on your fingernails. No redness or swelling to any of your arms. I'm going to check your neck. Just going to look for symmetry. Trachea is midline. I'm going to check for your lymph nodes. Your lymph nodes are good. And check for your thyroid. So go ahead and swallow. Very good. Can you move your neck side to side? And up and down, back, and all around? Okay. All right. Can you push up on my hands? Okay. Very good. One thing I forgot to do is check your Perla reflexes. So I'm just gonna use the light on my phone because the instrument broke. So if you, I'm gonna turn off the light and just look straight ahead for me. Good. Good. Okay. Alrighty. Have you had any discharge coming from your eyes recently? No redness or irritation,
No.
itchiness?
No.
Okay. I'm going to assess your nose. If you mind, just look up for me. Go look for the deviation. It looks symmetrical in there. No discharge coming from the nose. Have you had any problems with your teeth or anything recently?
Nope.
Okay, can you open your mouth for me? And stick out your tongue, move it side to side. Your cranial nerve number 10 works. Have you been to the dentist recently?
Yes.
Okay. Are you having any jaw pain?
No.
Can you open and close your mouth and move it side to side? All right, very good. And I'm going to assess your gag reflex. Does it work?
Yes.
Okay, because I don't want to make you gag.
Yeah.
But as long as it works,
It definitely works.
I'm gonna listen to your carotids for a bruit.
Okay.
All right, everything sounds normal, and we can see your jugular veins very well right there. Wonderful. We're gonna take a listen to your heart and lungs real quick. If you don't mind leaning forward, I'm gonna listen to your heart. And listen to the 4 valves. I have an even rate. I didn't hear any murmurs. Let's just go ahead and listen to your lungs while I sit there. Deep breath for me. Alright. Clear bilaterally. Have you had a cough recently?
Nope.
No, no cough. You haven't been feeling sick at all or anything?
No.
Okay. Why don't we have you stand up? We're gonna test some muscles. If you can just turn this way for me. And can you close your eyes and stand straight for me? Perfect. No swaying. If you'll take a couple steps for me, heel to toe. Okay, perfect. All right, and we're gonna look at your spine while you're standing up. So if you'll turn around for me and just kind of bend over. Does any of this hurt?
Nope.
No tenderness?
Nope.
Okay. No obvious curvature. Her spine is even. If you'll have a seat again, we're gonna listen to your tummy. Have you had any belly pain recently?
No.
No?
Oh, that's good.
Okay, gonna listen to your 4 quadrants. Alright, sounds good. And I'm not gonna make you take your shirt off, but we would look to make sure that your belly is symmetrical, there's nothing bulging, no rashes, no irritation, no lumps or anything. Make sure that your abdominal pulse is good. We're going to start with a light palpation. Let me know if any of this hurts.
Nope.
No? None of this is hurting?
Nope.
Okay, we're going to do a little bit deeper of a palpation to feel for some, make sure those organs are in place, particularly your liver and your spleen. None of this is hurting. There's no obvious bulges or anything. Okay, I'm going to look at your lower legs and see how they're doing. They are very symmetrical. They're warm. They're not cool. The color is great. I'm going to feel for your pulses, your popliteal pulses. They are strong bilaterally. Feel for your feet pulses. Very good. Behind your heels. Very good. And you can feel all this?
Mm-hmm.
No numbness or tingling?
No.
Perfect. And they're nice and warm. And your toenails look great. Okay. Do you have any questions for me so far?
No. Everything's
Okay. If you're going to test some more muscles real quick, if you'll grab my hands and squeeze them. Good. If you'll pull towards you, push me away.
Sure.
Okay. And then shrug your shoulders one more time for me. Perfect. And can you push my hands with your feet and then pull. Okay. And you haven't had any problems with your hips recently? No? Okay. Last thing I want to go over is just making sure, well, right before the end, I just want to make sure your reflexes are good with your knees. So I'm just going to check those. Your patellar reflexes. Oh, they work very well. Almost kicked me. There we go. Kicked me one more time. Okay. And then the last thing, I just want to make sure that you're doing your monthly self-breast exams, just to make sure that you're not finding any lumps. Make sure there's no dimpling, no lumps. If you find one, just make sure you go see your primary care doctor. Okay?
All right.
All right. Any questions?
No.
No? All right. Well, thank you.
Thank you.